There are overall 3 different types of studies. These are prospective, retrospective, and cross-sectional. A prospective study is one where a sample is taken and then the occurrence of an event in the future is recorded. A retrospective study is one in which a sample is taken and it is recorded if the event occurred in the past. Finally, a cross-sectional study is one where a sample is taken and the occurrence of an event happening in the present is recorded. Let's look at an example. This is an example based on lung cancer and smoking. The study was run in the 1930s in London, England. Patients from 20 hospitals admitted for lung cancer within the preceding year were polled about their smoking behavior. Then another set of patients that numbered the same that did not have lung cancer were polled about their smoking behavior. The analysts made sure that the patients had similar covariates such as gender. This is considered a retrospective study since the analyst is checking for an event that had occurred in the past, which is whether the patient smoked or not. Here are the results of the study. Notice that the number of patients in the groups that have and do not have cancer are equal. These are labeled cases and controls. This is because we consider this type of study a case-control study. In most studies, we would like to assess the conditional distribution for the response given a level of the input. For the lung cancer example, we would like to study the conditional distribution of cancer given that a person smoked. Unfortunately, we cannot get that from a case control or specifically a retrospective study. These types of studies only provide us with the opposite conditional distributions. For this study and any other case control study, it makes sense to consider each column as a binomial sample. The problem in this case is that these samples would not be considered independent. Let's take a look at the conditional distributions for the lung cancer example. Here are the conditional probabilities for the lung cancer study. Notice that the probability that you smoked given that you have lung cancer and the probability that you smoked given that you don't have lung cancer are both quite high. This is probably a reflection of the time period. Now that we have seen a retrospective study, let's look at some prospective studies. There are 2 main types of prospective studies. These are experimental designs and cohort studies. An experimental design is a study by which randomly allocated to groups, a treatment is applied and the occurrence of an event is then recorded. An example of this usually seen when dealing with categorical data is a clinical trial. A cohort study is one by which subjects choose which group they want to be in and the occurrence of an event is recorded. Let's look at how we could alter the lung cancer example so that it becomes a prospective study. The first situation would be considered an experimental design. This is because a subject is randomly assigned to be a smoker or not, then the occurrence of lung cancer is recorded. This, of course, would never be done because of moral issues. The second study would be considered a cohort study, since the subject decides which group they would like to be in. Then the occurrence of lung cancer is recorded. This type of study, again, would not be run. Let's now compare experiments to observational studies. An observational study is one in which the researcher observes which group each subject falls in and then records results. Some examples of studies that match this criteria are case control, cohort, prospective, and cross-sectional studies. Recall the definition of an experiment from earlier. The only type of study that could be run as an experiment would be a prospective study. Now let's talk about how sampling can dictate this type of study that we have. This example involves researchers in the Mass Highway Department. They plan to study the relationship between seatbelt use and accident fatalities. The study will be based on accidents that have occurred on the Mass Turnpike. Let's look at the different ways the study could be set up to correspond to the distributions involved. The first method that could be used is to randomly select 100 records from the records where the fatality occurred and 100 from the records where the fatality did not occur. This would be fixing the column totals. By doing this, each column total would become an independent binomial sample. This would be considered a case control study. Another method would be to take 200 subjects and randomly assign 100 of them to wear seatbelts, then make all of them get into an accident and record the results. This is similar to the previous study, except now the row totals are fixed and become the binomial random variables. This is an example of an experimental design. We know that this study would never be run based on moral issues. Now let's go back and look at the aspirin example. Here are the results from the aspirin example. This study was run by randomly assigning people to either the aspirin group or the placebo group. Then they observed whether or not a heart attack occurred. So what kind of study is this? This is a prospective study since the result was measured after the treatment was given. This is an experiment since people were randomized to treatment levels.